we are back with another program that is a gift of sight. I'm still Ismail Nkutu, and in the studio here I'm with Dr. Abdul Kiwanuka, who is the Director Gift of Sight, Humanity First Uganda. Dr. Abdul, you are welcome.
Thank you very much.
As you are well aware, in today's telethon, Humanity First is running a number of programs, and Gift of Sight happens to be one of those programs actually which are running in Uganda. Could you please tell us about the relevance of Gift of Sight in the country?
Thank you very much, Brother Isma. Humanity First being a charitable organization, and really we target, Humanity First targets those most vulnerable ones in our communities. And then when it comes to Africa, to the third world countries, not only in Africa, then it comes to Uganda. You know, when we talk about third world countries like the underdeveloped countries, but still these very countries have poorer communities. In Uganda we have about, you might find one region which has about only one health center, and this health center only has a medical officer. So that means that there are no specialists, and when it comes to eyes, we need the ophthalmologists, and these are specialists. And you will find that maybe in one regional referral hospital, a few specialists might be there, and these regional referral hospitals usually cover about 5 to 8 regions. So you can imagine those poorer communities where there are no transportation means. If they are very hard to reach out to these to the hospitals. So access to health care is limited, as you can is limited to the worst condition you can put it. So it is really a very great service that Humanity First does when it reaches out to these very most vulnerable ones in our communities who cannot even, because what happens that when it comes to the eye, very many people, it cannot only be me or you, very many people usually we don't give attention to our eye care. And you will find that a lot of these countries, especially in Uganda and the communities, that very few people really pay attention. We only wake up when maybe we've lost our sight. And when Humanity First comes up to avoid this, especially the surgeries we do, the cataract surgeries. These, you know, cataracts is avoidable blindness. By just a few surgeries, then someone can still be gifted back with their sight. So gift of sight is very, very important, and this project does far great benefit to our economic development of the societies.
So how is the Humanity First responding to restore the sight of those visually impaired or those ones who don't have anything like eyes?
The project of Gift of Sight, right now, what we are doing in Uganda, what we've done so far, we cover from the mobile eye clinic, where we've, recently, at the start of this year, we went to eastern Uganda, far in the east in the Mbale region, and then we went to the rural area, and we set up the screening camp. So the mobile eye clinic is catered for, because not only do we need surgeries when it comes to eye care, a number of people might only need a few medications. Some have infections, others have allergies. Then even the awareness is very, very crucial. You know, when someone is told you need to do like this, you need to treat your eyes like this, you need to avoid this and that, it improves their well-being. And then when it comes to screening, because basically we looked at cataracts, and we screened over 300 people in that village, giving them free medication, free health talks. And you know, when you look at these people who take ages, and when it comes, because just imagine one health center taking over an entire about 3, 4, 5 districts. So you can imagine the queue. when someone, you need to see a doctor, you need to be at the health facility by 6 a.m. The moment you come at around 8, you're likely not to see the doctor. And if you're lucky, you reach there when the doctor is even tired. So it will be just a walkover. So when you take this much desired health care to those people, it's a great service. So we screened about a number of them, and over 300, and then we identified 60 eyes for surgery, and we went back, we took them to the regional referral hospital in Mbale, and we operated successfully. And when you hear the stories of these people, these mothers and fathers and the children who are most likely going to lose their sight. One of our patient was a public servant, a lady who had lost her job simply because she was a teacher, but she couldn't see. So there's no way she was going to, you've been teaching because you could write on the blackboard. And now when you can no longer write, you can no longer read, you have no service. So she had lost her job. She tried to look out to see if they could work on her, and the charges were very high. You're having 1, 2, 3 ophthalmologists, so it becomes very hard. The costs will be very high because they have a lot of patients and the corruption is too high. So she had given up, and when she was very lucky that she had about Humanity First came, and then we offered free service, free surgery, free medication.
I can imagine
and the words she could say, if you could listen to this woman, we had given back the entire lifetime of this woman and her entire family. So this is how far Humanity First, how far the service that Humanity First offers to our population through this one project of Gift of Sight.
So beside the cataract surgery, is there any other service which you do under Gift of Sight?
Yeah, when we do these camps and the mobile medical clinics, we find a number of eye complications. We look, one thing to clear, Humanity First has looked so much at on cataract surgery, like I said. Cataract is avoidable blindness. Other cases, it might be hard, like when you have glaucoma, your entire retina dries out and little can be done to save your eyes, especially if this condition is discovered late. But cataracts, no matter, it's very hard for you. It is something that is easily avoidable.
I wanted our viewers actually to get a bigger picture. What do you do more than cataract?
So when we go, because like I said, when you go and you stage a camp, you're not only going to see, this is why it is screening. So when we stage the camp and we take our information on the radios, we meet different community leaders, health leaders, hospitals, and the communities are made aware of the eye camp that is going to take place in their area. The people turn up in large numbers. So we have those having eye complications, we have those having infections, and with infections they can easily be given medication. And we go with that medication and we give them full prescriptions such that they completely take the medication, the different eye drops, until they cure. And then we even arrange for them fallbacks in case, because what we do, Humanity First does not only cover, because it is open service. So we have different doctors who volunteer and join the course. And then we have these follow-ups in case there are other complications. So when we look at the infections, we give them the medications. Then those who are having refractive errors, Humanity First gives them the glasses. Then those who who would require surgery, then we go for the cataract surgery. And this is so far what Humanity First is doing, and any other complications that come up, if it is not handled with Humanity First, we offer the relevant medical advice to the patient.
I'm sorry that we are running out of time, but I just wanted one thing. You talked of the ginger, that you are going to have another program in ginger. So in just a few seconds as we wind up because of time.
Yeah,
to tell our viewers about that, the plan for that.
Humanity First in Uganda is so far linking up with different regional referrals, because these are the areas which where we find the theaters, and a variety of people are used to this. This is where we are having the specialists. So Humanity First was in Mbale. This year we are looking at going to Jinja, such that people come, we want to go to Masaka, the different regional referrals, and people come, and then we still offer the same services to the different regions of the country.
Humanity First 7